Moving towards a stricter lockdown tonight. After a flurry of meetings, President Cyril Ramaphosa will be addressing the nation at 8 o'clock. It comes after a rapid deterioration in the picture around COVID-19 in recent days. New single-day cases reaching record highs around Christmas. And data is suggesting that the second wave that we're currently in, that South Africa is experiencing right now, may be much deadlier than the first. Well, yesterday, South Africa breached the 1 million mark in terms of the total number of cases. The total number of deaths has risen to close to 27,000. To discuss ahead of that presidential address, we're joined by Professor Alex van den Heever from the Wits School of Governance. Professor, thank you for being with us as always. The second wave threatening to be more deadly. I mean, we spoke to a doctor earlier tonight saying in Gauteng projections could be, or the projections are that we could see double the number of cases, double the number of deaths compared to the first wave. The new variant, would you agree, is just one of the worst things that could have happened to South Africa?
Well, the question really is understanding fully what's going on at this point. I mean, there are two factors that are important. One is the behavioral change that has occurred from when we were doing quite well after the initial surge in infections. And then there is the second factor, which is the possibility of a variant that might be more, that might spread the virus more efficiently. And the question really is which one is more important. And I think that our behavioral change has been very significant.
All right, Professor, we lost you. If you can hear me, let's try again. You were saying the question is what's driving this, the variant or behavioral change, and behavioral change, you say, very significant.
Yes, so a lot of studies are indicating that super spreading events are the critical determinant of the so-called R squared, or the R0 number, the reproduction rate of the epidemic. And if we're allowing a small number of people to infect a large number of people at critical events, then we're going to have a very efficient spread of the virus. And there appears that that is in fact what has been occurring over the past 2 months. It's also important to note that what we're seeing today is indicative of what happened about a week ago. And so we're not going to prevent what happened a week ago. So the question really is, what do we need to regulate to get the behavior to a point at which the super spreading events are contained? So despite the fact that there's the possibility of a more efficient version of the virus at spreading, it's these human behavioral contexts that are critical to manage the epidemic going forward. And it's not shutting down everything, it's stopping those gatherings and those contexts that are important.
Well, there are a lot of questions here. I mean, that rage event that went ahead in Ballito, more than 1,000 youngsters from Gauteng, we learnt, had travelled to that event. So certainly, not within the 250 or so people, according to the regulations. The cops know about that event. Provincial authorities, it happens every year. So do you have questions about, for example, how did something like that happen?
Yeah, I think that so certainly the regulations that we have now are not being observed and not being enforced. And that has consequences because at those initial events, a very small number of people infect a very large number of people, and then they go home and they infect their parents and a few of their friends. So the secondary and sort of tertiary effects of that initial event reproduce the initial infection for a while. And so there's a kind of a wave coming through from that. So 1,000 infections turns into 3,000 infections, despite the fact that it's not super spreading from then on. But that's very difficult to stop that. But the super spreading event is possible to contain. Now, I don't think that those rage parties are isolated events. I think they're indicative of a pattern that was prevalent. I think that there's been a general position where everything from pubs and certain restaurants and shebeens and other kinds of parties have been held on the assumption that this isn't a very risky period to be doing this. So that is, I think, where a major problem is if we're focusing on prevention at this stage. But it points to the fact that human behavior is very difficult to manage through regulations. And what we really do need to be focusing on right now is something that we have no information on from government, which is the vaccine. This is really going to be the intervention that stops surge after surge after surge, because we are going to face multiple surges going forward into the future. And we will not really be able to contain and manage human behavior in every context and every setting. And we certainly can't close the economy. So what we will have to do is get on with the one single prevention method that will have the most dramatic effect, and that's the vaccine strategy. And up to this point, we have no information on such a strategy.
Well, government has said we're basically in the queue, as it were, because we've joined this facility with huge purchasing power, COVAX, although, of course, then it was reported that the first payment was late. So you're saying it's hard to assess whether government is really doing the best for its citizens when it comes to a vaccine right now?
The COVAX strategy is not sufficient for the South African context. It's only going to give us access to 10% of our requirement for herd immunity. And they're talking about having that available after June. I mean, we've got countries of South Africa's level of development that are rolling out vaccine strategies now. So they're beginning to vaccinate frontline health workers who critically need it. And in South Africa, we critically needed public and private sector. That is absolutely crucial. But we can't wait until June when we've had 2 surges before we actually have a vaccine that is rolling out at some sort of relatively low level. But we have no starting date. We have no indication of how many doses we would have. And COVAX is not sufficient for South Africa. We have to have bilateral arrangements with the pharmaceutical manufacturers that deal with these vaccines. We have to set it up, and we have to do it at scale, and we have to do it way before June.
Yeah. Does it make any difference, the early announcement that Aspen would be in conjunction with one of the manufacturers providing vaccines here, or manufacturing vaccines right here in South Africa? Of course, it depends on the trial for that specific vaccine.
Yeah, so it's very likely that vaccine will succeed. I think its trial has been successful. But there's no indication that any arrangement has been made between South Africa and Aspen and Johnson & Johnson for the purchase and distribution of that particular vaccine in South Africa. But we're also responsible for several other trials, including the AstraZeneca trial. And these are ones where there's no agreement or arrangement with AstraZeneca. So you have to have these bilateral agreements. And these are actually quite affordable. In the case of the Johnson & Johnson vaccine, it's going to be offered on a cost-plus basis, not a profit. There's not going to be a profit margin in it. It should be distributed in South Africa at scale. So it's eminently affordable. The question is, when's the start date? But what we can't do is go through again and again this process of trying to say, how do we contain another surge in the virus? Because it's going to continuously happen, and we really don't have the prevention machinery in South Africa to stop this virus from going through wave after wave.
Professor, can I challenge you? Are you being realistic, saying we need to get in line for those vaccines? Because as far as I understand, the first vaccine that is viable and on the ground from Pfizer, we need the logistics, you need those cold storage facilities, which many African countries, perhaps South Africa, doesn't have. So we're in line for the second or third vaccine. It will take a little bit of time, and South Africa will have to assess those trials. Everything is in flux right now.
No. So on the one hand, yes, Pfizer is a very difficult vaccine to distribute in a country context such as South Africa. But they are not the only vaccine around. And the AstraZeneca vaccine and the Johnson & Johnson vaccines we can distribute them relatively easily, and they're quite affordable. So really, once the starting gun goes, which is when SAHPRA approves and registers these particular vaccines, so that's the starting point. Most countries haven't waited for that starting point to get commitments to a certain number of doses for a particular country. That's why many countries are rolling out, developing countries are rolling out right now, because they created commitments even before approval, because they know that there's going to be a rush on these particular vaccines, and they want to make sure that for their country they have secured enough doses to get them to a safety point early on and not sort of by August, September of 2021. So that's why countries such as Argentina and Mexico and Chile are rolling out now. They've already gone through the process of approving. So we really need to get to say, how many doses have we got commitments behind? What's our starting date for rolling out our program?
Yeah.
And it's eminently affordable in comparison to the cost of successive lockdowns in South Africa.
All right, so presumably you'd like some information from the President on vaccinations, on where we are in sort of getting into those queues around the world. From the President tonight, what else?
Well, firstly, you want that plan and strategy and starting point, and not an excuse as to why it's not on the table at this point in time. So that is quite critical. The other is there are two aspects to the prevention strategy now. One is enforcing the regulations we have in place. And the second is whether or not the regulations that we do introduce, if we introduce further ones, that they are actually going to be proportionate and properly targeted at the cause of the surge that we're seeing at this point, which is the large gatherings and the super spreading events. It's not everything in our economy. So it's those two aspects that I think will be important in addition to the vaccine strategy, which I think it's very unlikely that we will see comment on this evening.
Yeah. All right, so gatherings may be the low-hanging fruit there, because that doesn't sort of restrict the economy too much, you would think. So you can keep the economy open and target those gatherings.
Yeah, because those would have been what has caused the current surge. So there are knock-on effects from that. Somebody goes to a rage event and then goes home and infects their parents. So 2 other people get infected, or 3 other people. But at the rage event, 1,000 get infected at one shot. So you want to make sure that the event that infects 1,000 gets stopped. You can't really stop the knock-on infections. So I think that the overkill is when we try to stop everything. The leveraged interventions are focused on the super spreading contexts.
You have raised the lack of law enforcement, though, around the recent super spreader events. I'd like to ask your opinion. Has there perhaps been a change in attitude? During the first hard lockdown, there was a lot of criticism of some law enforcement officials sort of taking things too far, being very power hungry. The SANDF involved in a serious incident, a woman selling atcha bundled into a police van. Many saying the police's role was also to educate, to urge people to explain things rather than being heavy-handed. Do you think maybe we went too far in the other direction of being nice?
Well, I think that we haven't been nice. We haven't been doing our job. So part of a proportionate response is making sure that those particular contexts that represent a genuinely high risk are targeted and dealt with efficiently. And what we don't want is police or military running around chasing individuals who do not represent a super spreading risk and treating them badly. So the super spreading events are the crucial target and focus. But what we've tended to see is that we have enforcement of contexts which are not terribly important for super spreading, and no enforcement of those that are. I see now in the past couple of days that there has been that kind of focus and beginning, but it's very difficult to know the extent to which regulating these particular contexts has really occurred. It's not necessarily every shopping centre that's going to be important, but it is going to be a party, it is going to be a shebeen, it is going to be a pub, all in enclosed settings with poor circulation, where people, and if you don't shut those down, we're going to have a problem. But we don't need everybody to be targeted.
Sure. What about alcohol? The speculation is rife there, and maybe there's some choices here. You can stop on-site consumption, but the restaurants say that really hurt them very badly in the first lockdown, or you stop sales completely.
So if you stop sales completely, a sort of a generalized prohibition just encourages, as everybody knows, black markets to occur and underhand drinking. And in fact, the contexts that represent the greatest threat to super spreading are likely to continue. But the ones that represent a very low risk, such as a restaurant that is safely protecting its clients and people on the site and in properly ventilated areas, their drinking in that context represents no risk at all. So the issue is really how you differentiate so that you don't have a blanket approach that targets people, the good and the bad at the same time. We've got many environments that are being well managed, and then we've got these areas which are very poorly managed. So I would say that there's a differentiated approach that's possible, but there's a tendency for government to pick very simple approaches and generalize them and then enforce them on the sort of the guys who aren't actually representing the biggest threat to the spread of the virus. So I think that the issue is a proportionate response means that you've got to prioritize your regulatory effort on those areas that represent the greatest risk. So banning all alcohol means that you start to enforce that provision against people who are not representing a risk at all, and you're actually just wasting resources.
All right, let's look at some of the other expectations. Firstly, a quick reminder, if you've just tuned in, President Cyril Ramaphosa expected to address South Africa at around 8 o'clock tonight. That's in about 4 or 5 minutes' time, and we will take that address for you live. Professor Alex van den Heever, what are you expecting in terms of inter-provincial travel that was banned in the first lockdown? But of course, there's this complication, the year-end rush, and many people currently on holiday.
Firstly, as a prevention method, I don't see it as having any effect at all. If you had to try and introduce it in order to counteract the surge that we're seeing now. Because the virus is already in every single context. It's in every single environment. So somebody who's positive going from the Free State to Johannesburg doesn't represent a risk of seeding the epidemic anywhere else. It's already community-based in Johannesburg. The question really is whether the community-based infections are finding these areas where they can spread asymmetrically. And that's what we have to manage. So it's quite possible that government will try and deal with inter-provincial transport, but it will have no effect. It's a completely useless intervention. The second reason why that would be useless is that most people are bypassing it in any effect. There was inter-provincial movement regardless. So it doesn't prevent inter-provincial movement because the roadblocks and so on are bypassed relatively easily. Yeah. So it's not really a very effective method. You have to focus again on the risk, the areas of highest risk. So I would expect if they were thinking rationally and properly advised, they wouldn't do that.
All right, and like you say, you'd have to man these myriad of routes into the various provinces. Professor, stay with us. Let's look at some of our viewers' tweets. Now, we asked you earlier, what would you like to hear from the President? Should we look at a stricter lockdown as South Africa? Let's take a look at what some of you have had to say. And he says, good evening. Some citizens are not adhering to lockdown regulations, and those of us adhering to the regulations are paying the price. Stricter measures need to be put in place, and those that are not adhering should pay the price of their actions. So you and our analyst tonight are agreeing. Thank you very much, Annie. By the way, we now welcome our viewers from SABC2. This is a very special broadcast in the run-up to President Cyril Ramaphosa addressing South Africa tonight, amid speculation that we could be looking at some stricter lockdown regulations due to the surge in COVID-19 cases reported in recent days. All right, let's get back to the tweets, see what some of you have had to say. Kaida Minga's solutions is to have tough regulations for the sale of alcohol, strictly ban social gatherings, and make sure that law enforcement are at work imposing high maximum form of discipline. Curfew must start at 9 o'clock until 4 o'clock. Let's put lives before profit, the economy. And Zawadi, finally, entertainment venue should be closed down, period. Police patrol and arrests of both venue owners and those in these establishments be seriously enforced. Curfew brought to 7 o'clock. Police to arrest anyone in public without masks. We cannot afford to shut down the country, although Zawadi, the restaurants would say that by bringing that curfew to 7 o'clock, you're shutting down their businesses. Professor Alex van den Heever, your comments on any of these? I guess what's coming up again is that debate. Should you focus on the economy, livelihoods? It gives you chills to think that breadwinners will just not be able to feed their families. Or do you focus on the health issues and lives? Maybe we can sort of wrap up this conversation heading towards the President's address. What do you think a smart lockdown looks like that considers both lives and livelihoods?
You have to focus on the gatherings. The economy, unfortunately, has to stay open because the economy is both drives our tax revenue for government, and government is already in dire straits. It's caused a 7 to 8 year fiscal impact on government. It will not be able to raise the capital to finance the deficit if we have another generalized lockdown. That is just out of the question. So it's not a question of lives versus profit. The economy is fundamental to the survival of our society, and therefore we have to look at proportionate responses that are focused on the problem. And unfortunately, we haven't focused on the causes. So that means regulating the size of gatherings is different. It has the least impact on the economy and should be our key focus.
And then when it comes to, are we looking at further measures? We've seen this rescue plan announced earlier. That was after the hard lockdown. So if you keep the economy open, you limit the need for rescue measures. But many still crying out for help. Small businesses saying they didn't receive the help that they needed. Many calling for that 350 Rand grant for the unemployed to be continued. But government says it has no money. In fact, Professor, I'm sorry, we have to wrap it up there. President Cyril Ramaphosa about to address the nation. We'll take that for you live.